So the ORATOR trials were multi-center trials comparing upfront surgery with transoral robotic surgery typically to non-surgical management of low-risk oropharynx cancer. ORATOR 1 was completed over about 6 years and 6 institutions in Canada and Australia. What that study showed was superior swallowing outcomes measured by IMDASI at a 12-month mark, although these results were diminished over time. Unfortunately, it didn't reach the clinically meaningful threshold of a difference in outcomes, and there was concerns about the surgical quality in the trials because of bleeding death in ORATOR 1. In ORATOR 2, it was a trial comparing best of approaches for surgical and non-surgical management of oropharynx cancer. Unfortunately, that study was closed early because of toxicity in the surgical arm. Again, a bleeding death was observed in a patient after surgery, even with prophylactic ligation of vessels in the neck and with a prophylactic tracheostomy, raising concerns about, again, the quality of the surgical approach in these patients. Comparing the results of ORATOR 1 and ORATOR 2 to a much larger experience in the US, ECOG 3311, where the bleeding death rate was 0.2%, an 18-fold increase in death from bleeding from ORATOR 1 and 2 is unacceptable. And unfortunately, the study was closed early, so we won't get a result, but I think future research will, bear out the safety of a surgical approach in well-selected patients.